Hello there, my name is Kamran Bhopal and this is a video of an overactive bladder with urgent continence station in the ST3 urology interviews. You may have seen my video for stress incontinence and more or less the history is very similar. So I will quickly go over it. There might be slightly separate points, but I think if you know the stress incontinence history, you will know your urgent continence and overactive bladder history as well. So the way I would present it is, I will see this patient in the Lutz clinic with a bladder diary and an ICIQ UI questionnaire. I would look at the referral letter and review any previous investigations present on the system. I would check the patient's understanding and also check the identity of the patient and take a focused history of lower urinary tract symptoms, trying to characterize any storage or voiding lower urinary tract symptoms, storage being frequency, urgency, nocturia, voiding being weak stream, intermittency, straining, and incomplete emptying. Also check for any incontinence and classify it, if present, into stress, urge, and mixed incontinence according to the trigger factors such as coughing, sneezing, which is stress, or rushing to the toilet and leaking, which is urge, and whether both of these symptoms are present and which one is worse. I would ask for the onset, duration, and progression of these symptoms, the severity of these symptoms, such as the number of pads being used, and I would rule out any urinary tract infection and STI symptoms. I would check for lifestyle, such as fluid intake, caffeine, alcohol, and fizzy drinks, as well as red flags including weight loss, anorexia, neurological issues, or a continuous leak indicating fistula. Then rule out any predisposing causes such as surgery to the pelvis, pelvic radiotherapy, urological procedures such as catheterization or stone surgery, etc. Neurological issues such as multiple sclerosis and spinal cord issues, number of children, vaginal deliveries, last menstrual period, and diabetes mellitus, heart failure, and chronic kidney disease. I would then check for medications such as hormone replacement therapy, use of diuretics, any trial of beta-3 agonists, anticholinergics, anticoagulants, and allergies. Family history of urological cancer, social history, smoking, alcohol, performance status, and I would then ask the patient how this is affecting their quality of life, and also close the history asking about the ideas, concerns, and expectations of the patient. So this is how I would close the history. I've done this history pretty quickly because we've done a stress incontinence history, and it's very similar to that. And you can look at that history as well and apply it to this. Usually, urgent incontinence would come with an overactive bladder, and there's different reasons why that can be. We'll do a separate station about how we deal with urgent incontinence and how we would move on, even examining patients with this. This is primarily a history video. I wish you all the best. I hope all of you get a national training number, and I'll see you next time.